Everyone, thank you for joining my talk. First, I would like to acknowledge the traditional custodians of the land where I'm sharing my talk from, the Wurundjeri people of the Kulin Nation, and to pay respect to the elders past, present, and emerging. I'm very excited to share with you our findings from a study where we evaluate the changing patterns in how systematic review is being reported and how data is being shared. Special thanks to my supervisors and my colleagues at the Methods and Evidence Synthesis Unit who have generously supported this project. So this is a series of studies as part of the REPRISE project, which aim to evaluate the reproducibility and replicability of systematic reviews. This will be the first study in the series where we will evaluate the completeness of reporting and sharing of review materials in a cross-sectional sample of systematic review. So my fellow systematic reviewers would agree with me that the road to evidence synthesis is always paved with multiple judgment calls and decisions from the time you're conducting your database search, your selected studies, doing your data collection, doing your risk of bias assessment, to the point you are designing your statistical methods of your meta-analysis. All these are important informations that readers want to know when they are assessing the validity of systematic review. And with that in mind, it is very important that systematic reviewers report these details as completely as possible to eliminate any uncertainty. It will assist future systematic reviewers who are interested in replicating or reproducing such systematic review. It will also assist the general reader in interpreting, validating, or generally applying the findings of the review to the particular context. And overall, it will promote open science in evidence-based medicine. And with that in mind, a lot of reporting guidelines have been developed over the years as a guide for systematic reviewers when they are writing the report of their systematic review. So we are coming into this picture with two particular questions that we want to answer. Firstly, whether the practice of the reporting the review, as well as sharing data of the review improved in the last 6 years, and whether the increased adoption of the reporting guidelines had any role to play in these changes. So we selected a sample of 300 random systematic review from 6 databases that were indexed in late 2020, underwent your double screening with 2 independent authors. And so our study covered a wide range of health topics, different types of interventions. We try to aim to make it as representative of the current literature of systematic reviews as much as possible. So in data collections, we are aiming to collect as much details about the reviews as possible. So we recorded whether the authors reported their funding source, their COI, whether they cited a protocol or reservation record, whether they stated their PICOS eligibility, whether they include all these information about the search strategy that will enable a faithful replication of such search. We also recorded whether they include details about the other processes of the review, as well as the statistical methods that were adopted for the meta-analysis. And last but not least, we also recorded whether the author shared the data underlying the meta-analysis. So to answer the first question, has the practice of reporting methods as well as sharing the data code improved in the last 6 years? The answer is, as you've seen, yes and no. When we're looking at this answer, we are comparing, we took a subsample of our 2020 systematic reviews with only health interventions and excluding Cochrane review, and we compare it with a sample that were indexed in 2014, a comparative sample. And we found that systematic reviews in 2020 were more likely to report that they use a reporting guideline. They were more likely to report using their funding source, whether they have a protocol, the date limits they use for search, separate search strategy for all the databases that they reported searching. And lastly, the data preparation methods. So calculations of missing data or calculation of the effect estimates used in the meta-analysis, for example. However, as you have seen from the remaining items from our data extraction form, we didn't see any conclusive improvement over time. And especially there was no improvement as well in terms of the frequency of sharing data or code underlying the meta-analysis. As for the second question, did the increased use of reporting guidelines have any role to play in these patterns, changing patterns that we have seen? Answers again, yes and no. So for this question, we are looking only at the sample in 2020. So we're comparing systematic reviews that make a reference to a reporting guideline in their manuscript versus those that didn't. And we found that studies, reviews that are referencing a reporting guidelines tend to report more frequently their protocols, tend to report which interfaces they use to search the database, their date of the last search, again, different search strategy for separate databases, as well as other informations, including Taosware estimator that were used. And more importantly, they tend to share the data and materials more frequently. However, as you have seen from this graph, the results are statistically not conclusive on these, the performance of these systematic reviews. So in summary, between 2014 and 2020, we observed some improvement in the practices of reporting systematic reviews. However, the frequency of sharing data analytic code underlying the meta-analysis remained rare. We also observed that citing a reporting guideline in the review report is becoming a more common practice. However, we see that such self-reported use of a reporting guideline, it might play a role in encouraging some of the good practices in reporting systematic review, but it didn't account for all these changes or improvement that we have observed over time. So there would be other factors underlying these changing or discouraging the complete reporting of systematic reviews, which we will explore in our subsequent studies of the REPRISE project. So thank you for your attention and welcome any questions.